Welcome to our in-depth exploration of a rather unusual and often overlooked topic in urinary system diseases: Guaifenesin stones. While calcium oxalate and uric acid stones are commonly discussed, these lesser-known formations deserve our attention. We'll unravel their mysteries, starting with what exactly they are and why they form. The primary cause of Guaifenesin stones is, unsurprisingly, the long-term and excessive use of medications containing guaifenesin. Guaifenesin is an expectorant commonly found in over-the-counter cough and cold remedies. While generally safe in recommended doses, chronic, high-dose ingestion can lead to its metabolites precipitating out of the urine and forming crystalline structures. Underlying conditions, such as dehydration or pre-existing kidney issues, can further increase the risk. The pathophysiology of guaifenesin stone formation is relatively straightforward. After ingestion, guaifenesin is metabolized in the liver. The resulting metabolites are then excreted through the kidneys and into the urine. When these metabolites reach sufficiently high concentrations, particularly in conjunction with a low urine volume or altered urinary pH, they can crystallize. These crystals then aggregate and grow over time, eventually forming stones large enough to cause symptoms and potentially obstruct the urinary tract. Due to its relatively uncommon nature, the exact epidemiology of guaifenesin stones is not well defined. They are certainly much rarer than calcium oxalate stones. Those at highest risk are individuals with chronic respiratory conditions or other illnesses that necessitate long-term, high-dose guaifenesin use. Over-the-counter medication use, especially among those who may not be closely monitored by a physician, contributes to the potential for this condition. More research is needed to accurately determine its prevalence. The signs and symptoms of guaifenesin stones are similar to those of other kidney stones. These can include intense flank pain radiating to the groin, hematuria or blood in the urine, nausea and vomiting, dysuria or painful urination, and frequent urination. In severe cases, a blocked urinary tract can lead to hydronephrosis or swelling of the kidney due to urine buildup, potentially causing kidney damage. The severity of symptoms often depends on the size and location of the stone within the urinary tract. Diagnosis of guaifenesin stones typically involves a combination of methods. A thorough medical history, including detailed information about medication use, is crucial. Urine analysis can reveal the presence of crystals, though specialized testing may be needed to identify guaifenesin metabolites specifically. Imaging techniques, such as a CT scan or ultrasound, are essential to visualize the stones and determine their size and location. CT scans are generally preferred due to their high sensitivity in detecting stones. While guaifenesin stones don't have distinct classifications like some other types of kidney stones, their size, location, and the degree of urinary obstruction they cause can be used to categorize the severity of the condition. Smaller stones might be asymptomatic and pass spontaneously, while larger stones may require intervention. Treatment and management of guaifenesin stones focuses on pain relief, promoting stone passage, and preventing recurrence. Pain management often involves NSAIDs or opioids. Increasing fluid intake is essential to dilute the urine and encourage stone passage. In some cases, medications like alpha blockers may be used to relax the ureter and facilitate stone passage. For larger stones or those causing significant obstruction, surgical intervention, such as lithotripsy or uroscopy, may be necessary to break up or remove the stones. Prevention of guaifenesin stones is primarily aimed at minimizing excessive guaifenesin use. Individuals who regularly take guaifenesin should be monitored by a physician. Staying adequately hydrated is crucial to dilute the urine and reduce the concentration of metabolites. Avoiding excessive use of over-the-counter medications and seeking alternative treatments for cough and cold symptoms can also help minimize the risk. The prognosis for individuals with guaifenesin stones is generally good with appropriate management. Most stones can be successfully treated, and kidney function can be preserved. However, recurrence is possible if the underlying cause of excessive guaifenesin use is not addressed. Recent research is focusing on understanding the specific mechanisms of guaifenesin metabolite crystallization and developing targeted therapies to prevent stone formation. Additionally, studies are exploring the long-term effects of chronic guaifenesin use on kidney health. As our understanding of these stones grows, so too will our ability to effectively prevent and treat them.